This video will detail how to care for your Jackson-Pratt drainage system. This video will show you how to milk the tubing, empty the drainage bowl, record drainage output, change the drainage bandage, and review common problems and solutions. A Jackson-Pratt drain, also called a JP drain, is a closed suction medical device that is commonly used as a post-operative drain for collecting bodily fluids from surgical sites. A JP drain is placed to remove pus, blood, or other fluid, preventing it from accumulating in the body after surgery. It also prevents the collection of fluid underneath the incision site, known as seroma. You will need the following supplies: a measuring container, alcohol pads, JP drainage output log, drain sponges, 3 to 4 cotton swabs, paper tape, 2 pairs of clean gloves, and hand sanitizer. Hand hygiene is one of the most important parts of care when managing your JP drain. Wash your hands thoroughly with soap and water. Washing your hands prevents the spread of infection and keeps you healthy. Hand sanitizer may also be used. When milking your drain, use your fingers to hold the tube where it is closest to your skin. Do not remove the bandage. Keep this hand in place to avoid pulling your skin. Use your thumb and first finger on the other hand to pinch the tube. Gently and slowly slide your thumb and first finger down the tubing away from the skin toward the bulb. You may use an alcohol swab between your fingers and the tube to help it glide more easily. Stop if this hurts or you feel the tubing being pulled out of the skin. Do this 2 to 3 times until the tubing is clear of clots. To empty the drainage bulb, unpin the JP bulb from your clothing unless it is hanging on a lanyard. Unplug the bulb spout. The bulb will expand when the suction is released. Pour the contents of the bulb into the measuring cup. Squeeze the bulb and fully empty the JP drain. When the bulb is empty, use one hand to squeeze the air out of the bulb. The bulb will become a crescent shape. Use your other hand to plug the bulb while it is compressed. Secure the bulb to your clothing or lanyard. To measure the output, check the amount of fluid in the cup at eye level. Measure the amount of drainage in milliliters. Write the date, time, and amount of drainage in the JP daily drain output log. Empty the contents of the measuring cup into the toilet and discard the fluid. Wash your hands thoroughly with soap and water. Before you change your JP drain bandage, perform hand hygiene and put on clean gloves. If you are not able to change your dressing, a family member or friend may assist. Loosen the tape carefully and take off the old bandage. Throw the old bandage into the trash bag. Look for any new redness, swelling, bad odor, or pus on the skin around the JP drain. Use a cotton swab dipped in soapy water and clean the skin around the JP drain. Do this 3 to 4 times, using a new swab each time. Take off the first pair of gloves and discard them in the trash bag. Perform hand hygiene and put on a second pair of gloves. Put a new drainage sponge bandage around the JP drain tube site. Use surgical paper tape to secure against your skin. Discard all used supplies in the trash bag. Wash your hands when you are finished. Common complications of drains include, but are not limited to, infections, bacterial invasion, fluid accumulation, pain or discomfort, blockage or clot, dislodgement, and foreign body reaction. Tips for care. Wash your hands before and after you touch the JP drain. Milk the tubing before you empty the JP drain. Empty the JP drain at least 2 times a day or when it becomes half full. After you empty the JP drain, be sure to squeeze the bulb before closing the plug. The suction is working when the bulb stays compressed. When you leave the hospital, a safety pin or lanyard will be attached to the JP drain. To limit tension on the tubing and prevent the tube from falling out, secure the safety pin to your clothing near the insertion site. If you have a lanyard, allow enough slack to prevent pulling of the tube. Make sure the tube is not kinked. Do not sleep on the same side as the tube. Do not submerge the JP drain site underwater. Call your care team if you experience any of the following. You suddenly stop draining fluid or think that your JP drain is blocked. You have a fever of 101.5 degrees or higher. You have increased pain, redness, or swelling around the drain site. You have questions about your JP drain care. Seek immediate help if your JP drain breaks or comes out. You have cloudy, yellow, or brown drainage from your JP drain site, or if there is an odor from the drainage.